when we use bra bands or things like that, you're sort of just overcompensating. And if the implants fall too fast or too much and you were using it's just things that we don't really need in the picture immediately after surgery. Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Smita, board certified plastic surgeon, and I've got Dr. Ashley Amalfi, my co-host and dear friend up in Rochester. Hi girl.
Hi Smita. Welcome everyone to Show and Tell.
Yep, we are continuing our series, our Show and Tell series, and today we are talking about a bra band. So we did a whole series on bras, so different types of bras after surgery, surgical bras, and today we're going to talk about a bra band. Oftentimes, I don't know about you, Ash, but oftentimes patients will come in, they'll see it, their favorite TikTok influencer who had a breast augmentation is talking about a band, and they'll want to know if they start that right away, what it is. And so I think this is going to be really helpful for people. But what do you tell people about the band? Do you use it right away? When do you use it?
I use a bra band only on some patients in some instances because I think oftentimes the implants are going to settle on their own. We just have to give it time. But if I feel like they should be settling a little bit more and they're being held up a little bit too high in the recovery process, then we'll bring in the bra band. So I do not give a band to everyone. I know some surgeons do, but I think you and I are aligned on that, right? We only use them when it's needed.
Exactly. Yeah, 1,000%. I think, our bodies are so good at healing, guys. And so I just feel personally when we use bra bands or things like that, you're sort of just overcompensating. And if the implants fall too fast or too much and you were using it's just things that we don't really need in the picture immediately after surgery. So our bodies are very good at doing what they need to do. The implants generally settle on their own, but same as you, Ash. If things are a little slow to settle, or one side settles faster than the other, and the other is just not catching up, then that's when we bring in the bra band.
All right.
So what is it?
I want to show you
kind of
what this looks like. We have black ones in the office too. I like everything black. I don't know why. It just looks sleeker.
Me too.
Anyways, this is a bra band. I mean, it's literally just like a giant elastic band with Velcro, kind of like the abdominal binder, but it's just really thin. So this kind of goes around your torso and it kind of clips in the front, but it's going to go on this upper part of your chest and wrap around your body. And it just puts some downward pressure on the top of the breast implants. So it's going to kind of go around your body and push things down. I don't know. Should I try this thing on?
You can try it on. We'll just watch you.
I want to. This is going to get weird. Yeah. But it kind of just goes like a seat belt. So it kind of goes over the top of your chest, and then you can adjust the elastic so that it puts a lot of tighter pressure on it. And what it's really doing is it's putting downward pressure on the upper part of the breast implant to kind of help things settle. So instead of just gravity pulling them down with time, your bra band is going to put that added pressure on the top there, and it's going to just kind of give a constant massaging pressure down, which is going to help your implant settle. And we can kind of do it on a diagonal if one of the implants is not settling and the other one is. So, I mean, it's not very exciting or complex. It's just a tiny little elastic band. It is a little annoying because it comes high, so you can't wear like a low-cut shirt. Right. But I just tell my patients, if they're going to wear it as much as you can. And if you're going to go out to dinner and you want to not go with this, I totally get it. So you could take it off as needed.
That is literally the only thing people complain about, is that it's just so high. But that's really important, guys. So, I know a lot of times when we give the bra band to patients, they immediately put it on, like actually on their breast itself. And you want it to be in the upper portion of the breast, right?
Yes.
Because it's essentially mimicking massages that sometimes we teach you to manually do. But this is just constant. And so you want it really sitting at the upper portion of where that implant is, so you get that downward push.
You can screenshot my donning of the apparatus. I'm sure these videos are going to haunt me. But yeah, it just goes on that upper part, like right where your bra fat is. You want it just kind of like pushing down on the upper part of the implant. And, and then usually I'll see those patients back a little bit more frequently, and you can see a big change. So sometimes patients, I just tell them, hey, if you feel it drop and I haven't seen you yet, you can totally stop wearing it, come back in and we'll check it out. Yeah. But not really a big deal, not really the most complicated device, but it really works. And I would just leave that to your surgeon's discretion, because if they think you need it, you should use it. If they don't recommend using it, I would not manipulate your implant on your own. I would listen to your surgeon's advice.
Yeah, I 1,000% agree. Just always double check. And this really goes for everything, guys. Anything post-operatively, right after surgery, just double check with your surgeon, because everyone is a little bit different. And a lot of what your restrictions or recommendations will be is based on specifically what was done in surgery. And that varies by patient, by surgeon. And so always double check.
Awesome. All right, you guys. This was fun. First time I ever
next week.
Wore a bra band. All right, you guys. See ya. We'll see you for show and tell.
Bye.
Bye.